This is the second part of my video on how to deal with ear infections. I'm directing my remarks to parents of children, but they apply to people of all ages. In part one, I talked about prevention. Now we're going to talk about how to treat an individual who has an ear infection. My first recommendation is 3% hydrogen peroxide in the affected ear. The person lies on the unaffected side, and you just put, say, 10 drops of 3%. It's got to be 3% hydrogen peroxide, available in any pharmacy or grocery store. Don't dilute it, just put it in there, and it will start bubbling. It may be irritating, the bubbling is kind of annoying, but they need to remain there for about 10 minutes. Do that twice a day while the ear infection persists, and then after the ear infection is gone, continue to do it once a day for a couple of weeks. After that, some warm garlic oil or some warm olive oil in the ear can be very soothing. And there are a lot of natural antibiotics. We don't have time to discuss all of them today. I do like oregano oil. You can apply it directly to the front of the shins or to the bottom of the feet, or both. Sometimes it can be a little strong. I recommend wild Mediterranean oregano oil. So you may want to mix it with coconut oil, half and half, before you rub it on. Also, if the child is crying because of the pain, you can take some chamomile, loose chamomile herb, or even a tea bag with chamomile, and open it and pour the chamomile out. Moisten it, don't make it wet, just moisten it with hot water, then heat up a towel, maybe a hand towel, with an iron, and then put the warm chamomile on that and just lay it directly over the ear. Have the child, again, lie on the unaffected side and put this right on top of the ear. It doesn't have to go down inside the ear. It can be amazing. How it works by not going inside the ear, I can't tell you, but it can be very, very effective and help ease the pain, and the child will stop crying. A lot of people believe the only treatment for an ear infection is antibiotics. I disagree, and I try to avoid antibiotics whenever possible in my life. And researchers tell us that 70 to 80% of ear infections are going to clear up spontaneously without any treatment. However, I don't believe in doing nothing either, especially in view of the fact that there are so many natural things that really work. And I'll talk about more of this in part 3.